Autonomic dysfunction. Dysfunction of autonomic nervous system can be seen in patients with spinal cord injury with a lesion at T6 or above, including autonomic dysreflexia, impaired temperature regulation. Impaired temperature regulation frequent problem in patients with spinal cord injury above T6 level. This is due to disruption of afferent input. Thermoregulatory center, and impaired control of distal sympathetic nervous system. Impaired control of distal sympathetic nervous system. Patient develop either hypothermia or hyperthermia as per environmental temperature, a phenomenon known as poikilothermia, very common in young spinal cord injury. Caregivers should be educated regarding exposure to hyperthermic or hypothermic environment, and the child must be dressed accordingly. Undressing in case of hyperthermia and putting back a blanket over the child in case of hypothermia are main steps. Undressing in case of hypothermia and putting a blanket over the child in case of hypothermia. Baclofen withdrawal will precipitate severe spasticity. Baclofen withdrawal will lead to severe spasticity leading to extreme hypothermia. Putting blanket over child in case of hypothermia main steps. OAD precipitated due to noxious stimuli below the level of lesion. Bladder irritation due to bladder distension, urinary calculi or infection. Most common cause, followed by bowel distension due to stool infection, pressure ulcer, tight clothing, burn, ingrown toenail, DVT, fracture, trauma, HO, atopic ossification, invasive procedure, hyperthermia, painful stimulus, rapid change in position from sitting to supine, hemorrhoids, internal or external hemorrhoids, insertion of suppository or enema. Few causes which can precipitate AD occurs in 48 to 85% of spinal cord injury patient at or above the T6 level as early as 2 to 3 weeks after spinal cord injury. The most important step of management in suspicion of AD, recognition of its symptom. Non-pharmacological measures include treatment of cause. Hypertension is to be managed promptly, placing the child in upright or sitting position with leg hanging down promptly. Minimize the risk of hypertensive sequelae on the cerebral vascular supply. If hypertension persists, Nifidipine immediate release may be given sublingually. If the systolic BP exceeds 120 mmHg in children, systolic BP exceeds 120 mmHg in children in less than 5 years, 130 in children between 6 to 12 years, and 140 in adolescent. Spinal cord injury patient with antihypertensive medication. Drugs recommended for use in children include topical nitroglycerin 2%, 1 inch, and nifedipine 0.25 to 0.5 mg